morning. This is Kimberly Warrix, the KCI Care Coordinator for our Prestonsburg and Paintsville Home Place Clinics. As many of you are aware, we have started seeing an uprise in COVID cases within our little communities. And so I wanted to go over a few things that could help limit exposure and hopefully keep you safe from catching the coronavirus. So the first thing I wanted to talk about is proper hand washing. And even though I don't have a sink in here, I'm going to be using just normal hand sanitizer for this demonstration. And this works with hand sanitizer as well. But when you wash your hands, make sure you are using an antibacterial or antimicrobial soap. And the CDC recommends to be washing your hands for at least 20 seconds from getting the soap on to lather to rinsing off. So I will be using, once again, hand sanitizer for this since I don't have a sink in my office. If I don't make a mess out of everything. And so the way you do it is you will rub to get your lather, and you'll want to go between your fingers. You'll want to coat back of each hand, and you'll want to lace your fingers together like this so you're going in between. And I'm going to switch hands, and I'm going to do the same thing to my left hand. You want to rub, and then you'll also want to pay attention to your thumb, and we'll pay attention to the other thumb. And if you have long fingernails, a good way to clean under your fingernails is to interlock like this and to rub together. Or you can rub like this if you have your lather, which, of course I don't have a lather right now, but you can do that with both hands. And then to just finish off, we'll put my hands under my imaginary sink, and then you'll towel dry or air dry according to what you want to do. And going for 20 seconds is recommended because that helps give the soap enough time, as well as helps rub off as many of the dead skin cells, any germs, any kind of bacterial things that you may have on your hands. And so 20 seconds, that's generally the equivalent of singing the ABC song or singing Twinkle Twinkle Little Star, something like that. So if you don't want to sit there with a timer, just sing one of those songs in your head, and then you should be good. Another thing that I wanted to talk about are masks. And I know that these have been a hot topic in the news and in the community. Masks are recommended not only for your own personal safety, but for others who may have issues that they can't wear a mask, such as somebody with COPD, somebody that may have severe breathing issues, and even in some cases, people that may have an autoimmune disease or they may have some kind of compromise with their autoimmune system. So you can get a mask like these. These are the medical ones, usually from Walmart, Rite Aid, CVS, Walgreens. Most places carry them in a box of about 100. Sometimes you can find a bigger box than that. And they're not really that expensive. So please keep a mask on you at all times. Change your mask every day. And if for some reason you can't change your mask and it's one of these medical ones that can't be washed, disinfect it with a Lysol spray, wipe it down with a Lysol wipe. Just make sure that you are disinfecting this. That way you don't take the chance of breathing in anything that may have come onto the mask when you put it back on. And also, can't forget our little fabric masks. So if you are wearing a fabric mask, the same thing applies. Make sure you're washing it after each use. They suggest to use the good old-fashioned hand washing way, hot water, soap. What I like to wash mine in is Dawn dishwashing liquid, just because it is antibacterial and it's really easy. You can put more or less on it without having to make too much of a mess. And you want to wash by rubbing it together like so, and you want to do it on both sides, of course. And then when you go to dry it, you can put it in a dryer. Just make sure that it's not going to shrink your mask. I had the misfortune of learning that the hard way, and thankfully this one's not that one. But you can let them air dry if you want to. If you put them in a dryer, put them on low heat. That way you're less likely to shrink it. But be sure anywhere that you go that is outside of your own home, be sure you're wearing one of these, please. Like I said, it's not only for your own protection, but it's for everybody else that's around you that may not be able to protect themselves. Maybe they're sick with other chronic illnesses, and you don't want to take the chance of exposing them to something that may possibly kill them. You may be okay, but you don't know the people that are around you. And so just please practice proper hygiene, wash your hands, clean things off. If you go anywhere that you may have put your purse, if you're a woman, or anything that you may have laid down, make sure you're cleaning it with Lysol spray. Cell phones, big thing. Make sure you're cleaning these off because we pretty much have these connected to our hands at this point in time. So please make sure that you're cleaning anything that you're commonly using. If you go out in public, just make sure that you're cleaning door handles. And I'm not telling you to go into Walmart or anything like that and just clean everything off, but I'm talking like your car doors. If you have to handle a gas pump or anything like that, make sure that when you get back into your vehicle, you're sanitizing your hands, you're cleaning your car door, whatever you've touched. That way, it decreases your risk. And I know that I've thrown a lot of information at you during this video, and I apologize for that. But keeping everyone safe, keeping my own family safe, keeping you safe, that is my top priority. I want to see not only my patients, but my community and my nation. I want to see us overcome this. And it starts with taking a few uncomfortable guidelines into consideration. So please wash your hands, wear your mask. If you don't have to travel, please don't. But if you have to go to work or anything like that, just take proper care of yourself, maintain social distancing, and have a great day. Thanks for listening. Once again, this is Kim Warrix, the KCI Care Coordinator for our Prestonsburg and Paintsville Clinics. If you have any questions, please reach out to one of our clinics. We are now in 8 locations with our Inez clinic recently opening. And if you need us, just reach out.